EHRs work very well. So let me start with that. But they work very well for the way they were created to work. We all had a push to get on the electronic medical records, and that really came from the government mandates saying we needed to get our electronic records up. And when you look at what electronic medical record was created to do, it's created to capture and document information so that you can bill appropriately, so that you can meet all your regulatory requirements. It's to capture all the information for caring for patients, but it truly is about regulatory and billing. And we want to plan of care on top of that. So that's what they were created to do, and they do it very well. And they do much more than that, but they're not. An EHR is not an end-all be-all. It just cannot be. And so hospitals have spent millions implementing their EHRs, but it's not going to meet all your needs. It's going to meet those needs, but what we've discovered over time as healthcare providers is, but it'd be great if I could also do this, or it could be great if I can also do that. And you see a lot of companies out there really selling solutions to kind of fill in some of the gaps of the EHR. So the EHR it looks at a point in time. It tells you what's going on with this patient at this point in time. And what we do at Lumeon is we're not competing with the EHR. So let me tell you that we're not competing. We're not replacing. We're not here to do that. We need our EHRs, but we work as an agility layer with the EHR, as an agility layer that has two-way communication. And what we do is we extend the capacity of the EHR. We extend its capabilities. So what we're able to do is build in tasking and engagement and automation into the capabilities of the EHR. So if you think about it, we're just extending its capacity, extending its abilities so that the team can do more. Yeah, absolutely. And EHR is a documentation system. It is. It is that system we build from. It's that system that we document care in. And what we do with automation, and it's that agility layer I talked about, and let me take you through a little bit more of an example of that, is I'll use surgery again. So when a patient's scheduled for surgery, one of the processes we often do is we reach out to the patient, everybody does it, to do an intake of the patient. And that's a phone call, it's a cold call. We call the patient, we're going to ask you a bunch of questions about your history because we want to fill in any gaps that we have. We then take that information and we're risk scoring it, and we're saying, this patient's high risk or medium risk, and we're taking actions based off of that. What we're able to do is to say, let's take that workflow, and maybe instead of you calling the patient, the EHR will let Lumeon know that the patient's been scheduled. We'll reach out to the patient. They believe it's white labeled, so it appears to be the hospital reaching out to them. Hey, we need to do an intake. Could you complete this form for us? We actually find about 90% of the patients will complete the form. So now we've just saved a ton of time, the cold calling and trying to collect that and then entering that in the EHR. We collected it from the patient. We wrote it into the EHR. The staff didn't have to go in and manually enter that. We also then gathered information from the EMR as well as the patient's feedback, and we risk stratified them. So we were able to use the risk stratification tools and score them instead of someone sitting down with a piece of paper and scoring. So what we're doing is actually looking at what are those activities that the team is doing based on the care of the patient that we can automate, and then we're driving that information back into the EHR. So if you think of the EHR, it's a system of record, and what we are is a system of action, but we're documenting that back into the EHR. So we're actually working hand in hand with it. But as a system of record, it's going to record all the things you need, but it's not going to take any actions. We're actually taking actions on behalf of the team to save them steps, and then we're recording it into the EHR for the team. So it's actually making it easier for them to gather the right data, the appropriate data, and then take action with the staff or with the patient. So we keep the patient and the staff moving down whatever workflow they're working on, whether that's getting ready for surgery, if that's bringing the patient in for a mammogram, if it's reaching out to someone about their diabetes. We can take their workflows, those actions that they're doing outside of the EHR, we can automate that and then really connect that back to the EHR.